My mega friends, family members, and everyone who has joined this talk, warm welcome. Warm welcome to my first episode on Good Health by Yourself, hosted by Wellness We Care, an initiative of Mega We Care, a conversation on truth about wellness. I'm in conversation today with Dr. Sun Chayot Singh. This is a Wellness We Care initiative to help us search for the truth behind all these stories that we hear every day. There's so much in the news, all kinds of news from TV to newspapers to Google, Baba as I call them. They have everything available at a call. But at the same time, we all still remain very confused. So our endeavor here is to search. We don't claim to know everything, and we don't aim to crucify anybody here and find faults in anybody on these talks. This is a scientific journey looking at present knowledge, knowledge that is scientifically documented, and there is enough evidence to show that they actually work. And to get out of medical jargon so that a lot of us who are normal human beings like me, I'm also an engineer by the way, but have been in the medical industry for a while, so probably I think I know a little bit more than others, but for the common person to be able to make sense of what's going around us. And the key objective here for all this initiative that we have started is to help people stay healthy as long as they live. Now, before I go any further, I would like to tell you, it's a disclaimer that I actually run a pharmaceutical industry business, and I'm not going to be selling any of my products here or promoting any medicines that we make. That's not the objective, and I will try not to do anything at all. This is all about good health by yourself. It's helping you to stay healthy as long as you live. Now let's get into some house rules. This is a conversation, so I will be talking to Dr. Sun Chayot Singh. The first part of our session, about an hour, will be a talk where I'll be asking him questions and he will give you straight, simple answers. After that, we have a Q&A. On top of your screen on the top end right side, I'm told there's a question mark, and that question mark is where you can type your questions in. We have a medical team sitting behind, and they will evaluate, review what has been answered and what we think we can answer and raise those questions. Anything that remains unanswered, we will try and put them in a chat. So let's begin. Dr. Sun, a cardiologist, a surgeon who changed his life to change his health. So I call him the saint doctor because in my understanding in Sanskrit, I come from India, so Sant means saint. So he's really a saint who's taken on to himself to help people stay healthy as long as they live. So I joined him on this journey to spread this message, to reach out to people in the developing parts of the world before they become like the developed world, before they become obese, before they have all those non-communicable diseases that is tormenting the developed world, and before it becomes unaffordable, not only for you personally, for your own pocket, for your own insurances, and for the governments of the country who go bankrupt trying to provide cure for people that they can manage and they can make some effort to manage by themselves. And above that, you lose the chance of living your golden years of your life, enjoying life with your loved ones. So with that, this initiative was started, and this is one of my first conversations with Dr. Sun. Today, we are touching on something which you all know a lot about. I'm sure you know a lot more than I do about COVID-19. Even if I try to tell you, you'll all have all the answers. But we are still going to try. COVID-19 has been around since 2019. Towards the end, we are probably about 18 months to 2 years into COVID. It doesn't seem to be going away. Every time we think it's gone, a new variant comes along. And especially for me, what matters is because we work in developing countries. I have colleagues who are joining me today from 33 different countries, as far as Peru, where the pandemic started very early and devastated the country, to now, like Myanmar, where we are seeing a phenomenal impact of COVID, where hospital facilities, medicines, so as well as treatment is not available. And all of us who thought that we were saved, for a while I thought we had all this immunity, because long ago there was all this news in the news that, okay, we have high viral load, we've been BCG vaccinated, and all these reasons were given why COVID is not going to come to the developed world. But it doesn't seem to be true. After the developing world has had its own fair share of COVID and deaths, it's now tormenting us, and it's right near our own houses. It's next door, and we can't run away from it. So, with that in mind, I thought it's a good idea to search for some practical tips, knowledge about COVID. So let me begin. Let me welcome Dr. Sun. Let me begin with asking questions to Dr. Sun. My first question to Dr. Sun today, that really, I think, concerns me very much, that does COVID affect all of us equally? The rich, the developed world, the poor world, the elderly, the young, the smaller children, the obese, and the one with disease, and the healthier. So Dr. Sun, tell us, what is your view on how COVID affects us? Does it discriminate or it doesn't? Over to you.
Rich or poor, developed or undeveloped, all are affected equally, but may not be equal in terms of individual age and individual health status. Does it affect the elderly more? Yes, it does. Elderly. If you look at the USA national statistic of about 600,000 mortality in death from COVID, 91.9% belongs to the age group from 55 years up. So definitely COVID affect elderly more. And from the health status perspective, the most eminent is the obesity, relation between obesity and mortality of COVID. One study done at the University of North Carolina, they used the cutoff body mass index 30, which is the cutoff for the obesities. Above that, chance to be admitted to the hospital for COVID patients if they have beyond 30 BMI. The chance increased 113% for hospitalization. The chance increased 74% for admission to intensive care, and the chance increased 48% for dying, for mortality. So from health status perspective, obesity is obviously affected by the COVID. About the age, elderly is bad, of course, but look at the young people under 18 years old. They are quite spared from the effect of COVID in terms of mortality. This age group, those under 18 years old, and they contribute to 13% of COVID infection, 13, but their mortality is only 0.7. So they are very safe from the COVID mortality for the young, except 3 small subsets, the obese children, the asthmatic and chronic allergic disease children, and very small child of smaller than 1 year, probably because the narrowing airways in this small subset group. Talking about the chronic disease. Obesity is not only one, but it's number one. Actually, we identify 6 or 7 chronic non-communicable disease who increase mortality in COVID. Obesity is number one, diabetes, heart disease, hypertension, chronic kidney disease, chronic lung disease, and cancer. All of these chronic communicable disease contribute to worse outcomes of COVID. So that's the overall picture of
Well, good.
COVID effect.
Thank you, Dr. San. That's good. So I should start. We should all start losing weight. Maybe we have to join some weight loss classes and do something about it quickly before we get COVID. All right. One question that always comes to mind, I personally had some fever symptoms the other day. 2 days ago I was suffering and I got chills and cold. And the first thing I did was to reach out to a COVID kit. Unfortunately, I had one AKT test lying at home, so I did it and said, good, I'm COVID free. So I think a lot of us have this fear now. Anything, whether you have a cold or cough, it always feels like COVID. I want you to tell us something about what's your advice on how do I find out if I have COVID? What are the symptoms? How do I know I have COVID? And when do I actually test? Do I start with an AKT test? Okay, there are a lot of videos to tell you how to do them right. And after doing an AKT test, when do I go and do an RT-PCR test? What kind of testing do I do to determine whether I have COVID, first of all? Because that's probably in everybody's mind. Do I have it? Because it's all over now. In most of our countries where we are, in all the developing world, we don't have governments doing COVID tests for us free. It's not easily available. And some places it's very expensive at the same time. So before we jump into it, it costs a lot of money. And I'm talking about middle class, people working. I'm sure the rich and the famous can do a lot of tests every day and get them done at home. But are there suggestions from you on how do we go about testing and finding out that we have COVID? Over to you, Dr. San.
That's a matter of self-diagnosis. To do self-diagnosis, you require 2 components. Component 1, the exposure to the COVID-infected patients. That's a matter of history. Component 2, you develop symptoms. The most common 3 symptoms: fever, dry cough, and fatigue. And there are another something like 12 less common symptoms: loss of taste or smell, nasal congestion, sore throat, red eyes, conjunctivitis, headache, muscle and joint pain, skin rash, including urticaria, nausea and vomiting, diarrhea, chills or dizziness, sleep disorder, and emotional disorder like irritability, confusion, and anxiety or depression. All of these are COVID symptoms. So whenever you expose to infected person and you developed any of these symptoms, then you diagnose yourself as you probably have COVID. About the test, you mentioned ATK, the antigen test kit, or what we call rapid test. Is it accurate? Yes, it is accurate if the test result is positive, because it has very high specificity, something like 99.9% specificity. It is positive. It is very likely that you get the disease. But when the test result is negative, it is not very sensitive. Practically, it quite means nothing. So if the history of exposure and the symptoms are very suggestive and the ATK test result is negative, you should go further to repeat the test or seek for better test, which is the RT-PCR test. RT-PCR is much more sensitive, something like 96.7% sensitivity and 100% specificity. So it's the most accurate test so far we have. But is very useful in a setting that you cannot get access to RT-PCR and you cannot get access to government or health system. If ATK test positive, we can go ahead to do self-isolation. Based on that, you can diagnose from positive ATK test for 99.9% or something confidence that you get the disease. Go ahead to do self-isolation. That is the benefit of ATK test.
So Dr. Sun, you mentioned now, I know I've done my ATK test. I have, suppose it turns out negative, then I should be going to do an RT-PCR test because the negative result specificity is low in ATK test. So that's when I should be actually, now I understand. So that's when I should be trying to get myself an RT-PCR test. Very good. But as I said, in some of our countries where we are, I mean, I'm talking about we work in 33 developing countries from Ethiopia down to Nigeria, Ghana. Yeah, there are tests available if you're a medical professional, but there are many people either can't afford it or the availability is very poor. What is your suggestion? What should we do? The next steps if the ATK tests are positive, do I need to look for another RT-PCR test, or I just self-isolate? Or if it's negative, should I look for an RT-PCR test because it's very necessary for me to find out, or just self-isolate? Any suggestions on that, Dr. San?
I think if you cannot get access to the healthcare system, if the ATK test positive, you go ahead doing a self-isolation straight away, no problem. But if the ATK test is negative, still, if the history of exposure was obvious and the symptoms were very suggestive, you should go ahead to do self-isolation. So either negative or positive, you should go ahead doing self-isolation.
All right, so that's good. Finally, one understands that there are ways. If I don't have the possibility to test, I should self-isolate. That's something that I've just understood now. So whatever happens next time, I'm going to self-isolate. Dr. San, sometimes, I mean, being in the industry, I hear from friends and people who live in different parts of the world. With all these tests available, especially if you can afford it, you find that you are now advised to do a lot of other tests if you have COVID or you have the possibility of COVID. I mean, there's so many tests at chest. I mean, a CT scan of your chest, an X-ray of your chest, a hemogram, a CRP, a D-dimer test. I mean, there are so many tests being advised now for people to go and do while they are potentially either they are COVID positive or they could have symptoms that are COVID positive. What is your advice on this testing? Is this something that we have to wait for a medical doctor in a situation when we're hospitalized to take that decision, or we should be running out and doing them on our own? Please guide us.
For the PCR positive, the diagnosis is finalized because the PCR is 100% specific. So there is no need for other tests. There will be only a small amount of patients, something like 3%, which whose the history of exposure were very definite and the symptoms were very suggestive, but the PCR test is negative. There are only 3%, I think. In those cases, I think CT scan to confirm the diagnosis probably useful. But that is the in-hospital setting. Those patients usually is admitted already in ordinary ward or in intensive care already, but the tests come out negative. That's when they want the CT chest. For other tests like hemogram or CBC, it is for the diagnosis of incidental bacterial infection. No, it's useless in diagnosis of COVID. For the CRP, that is for diagnosis of the hyperactivity of immune system, which occur late stage of COVID and occur inside hospital. No need to have this test outside hospital. D-dimer is for diagnosis of thrombolytic activities, which usually occur after clot formation. As we already know that clot formation occur in late stage of disease, of COVID disease, in hospital, not outside hospital. So outside hospital, you can make use of only ATK test or RT-PCR test, that's all. No other tests are required.
Thank you. So I get a better idea. I will not run after tests because I've been told I should do a lot of tests. I'll wait till the doctors tell me to do it. In places where we live, Dr. Sun, we have challenges, you know, by sheer nature of the environment and the housing facilities. We have family members living in joint families. You have few bedrooms, few toilets. If you have enough, I can lock myself in my own room and my food can be sent under the door. But if I can't, and shortage of hospital beds. I mean, I know it's very difficult to get a bed in Thailand as well nowadays. And there were times in India that we had last 3-4 months ago, we had complete chaos and huge tragedy going on with no oxygen available. That's a different problem, availability of medical supplies. But just to understand that at a certain stage when we need to, when is the right time to self-isolate? And if we are going to self-isolate within the family, in a common house, are there any suggestions and guidelines on how we can manage ourselves if we don't have the luxury of having a hotel or having a big house? What should I do? Should I move out and let the people with COVID live in? And how do I manage within that? Or I also self-isolate with them? I want some help to guide us to live through, because this is practically true in a lot of our lives, and we need to help them. We need to help our elderly parents, and sometimes our loved one need us close to them while we are not positive, but they are positive. So some advice on self-isolation, including what are your suggestions during this time on treating ourselves, on managing us during this in terms of hydration, food, all the other things that we need to do about managing this. I mean, it's a larger question that we have in the places where we live. But it'd be good to hear some advice from you as to how we can do that in the places where we are and in the countries where we live in. Over to you, Dr. Sun.
When to isolate, whenever you expose to infected COVID patients, that is the time to start isolation, self-isolation, at least 14 days. And how to do self-isolation? There are 7 important components. Number 1 is about the bedroom. If one can afford the isolate bedroom, that is the best. But if that is not possible, the patient's bed should be put far away from other people's bed, at least 1 meter. And the room must be well ventilated. I mean, open windows, no air conditioned. Number 2 is always wear mask, even inside your own home, all the time. Number 3, keep distancing from people inside the house, at least 1 meter distance. Number 4 is clean hands often. Number 5, you cannot go to work or go to public place. That is the definition of isolation. And number 6, your supplies. You got to ask other people to bring in your supplies. Number 7, in communication with other people nowadays, you need telephone or online communication. Try not to direct face-to-face communication. Concerning the what we call the disease management during the self-isolation, number 1 is you got to change your food. Change toward more plant-based food, because one big match case control study done in 6 countries show that those who eat plant-based food have 73% lower risk of COVID infection. So you should change food more toward fruits and vegetable, less on animal meat. Number 2, you got to drink a lot of water, because dehydration is the contributing factor to clot formation. Number 3, you need regular exercise, particularly breathing exercise. Also, you got to learn to lie on your tummy in prone position. Number 4, you got to manage your own stress because stress contribute to immune suppression. You got to manage your own stress, do meditation, muscle relaxation, Tai Chi yoga, or whatever that help you not to meddling with your own thought. That is the most important 4 components of disease management. Nutrition, drink a lot of water, regular exercise, and manage your own stress.
Well, that's good news. Looks like I'm getting there. I'm on a plant-based diet, so I should not get COVID. Great. Well, Dr. San, after the isolation and hydration and doing all the right things, I think there is a question which being in the medicine industry and since we like to treat things with drugs all the time, which is good. I mean, drugs are important. I have nothing against them. Vaccines are very important. Hats off to everybody. This is record history in the world that vaccines were developed in record time and they are available to the world, which has never happened in history. And their supply, though we complain about shortages, but to get 8-9 billion vaccines out in 1 year's time is a huge success story for the industry. And I think it's going to change the way world looks at medicine. But at the same time, you know, there's a mad rush to all kinds of medicine. A lot of times, I mean, personally, me as well, I'm guilty of it as well. I mean, when the first wave came, HCQ was very big, so we also thought about buying 100, 200 tablets and keep it in the office just in case. You know, so, but then
Hydrochloroquine.
Yes, so then the FDA, WHO said, oh, no, it's not needed. It doesn't have the scientific basis, but it was used. And now there's many more. There's Ivormectin. There are seminars going on Ivormectin, and people send me messages, can you supply? I said, sorry, we don't produce Ivormectin. Other than that, yes, we have heard approval by the US FDA of Remdesivir, and now there's whole stories towards Favipiravir, which is another drug from Japan for flu, and it's been repositioned for COVID, and there's a whole rush to make a lot of Favipiravir available to people in their daily packs, you know, so you take them every day and everybody's, so SCQ. Then you have MABs, you have monoclonal antibodies like Actemera, priced at $500, available at $2,000 and not available. So, and the steroids that in some parts of the world, steroids were used, and steroids led to black fungus, mouth fungus, etc., etc. So there's a lot of things going on, and there is people wanting, I mean, sure, we want to look after our loved ones, we want to protect ourselves, we don't care what happens to the neighbor next door, and we want to have drugs at home just in case, because in the places where we have no hospitals, no beds, no doctors, what do? You have to look after it. There's nothing wrong with it. So I'm just trying to find out your advice on are there things that we should stock up on, or what's the right science at the moment behind all these drugs that we are talking about, at least to give us a real view on where the science lies and what should we be doing. So over to you, Dr. San.
I think this is very serious matter. You know, I just learned from you that people use steroid and followed by the complicated viral fungal infection. Let's go through those medication you mentioned, the names one by one. The first one is Ivermectin. There are a lot of research done on Ivermectin. Some say it's good, I mean for COVID infection. Some say it's not good. But the best evidence is the meta-analysis of randomized control trials done by Cochrane Library. They reviewed 14 randomized control trials covering 1,678 patients. The result of the review showed that Ivermectin is not different from placebo in terms of mortality, viral clearance, need for ventilation support, hospital length of stay, and COVID prevention. So I do not recommend using Ivermectin or storing Ivermectin at home at all, because the scientific evidence does not support that. Number 2 is Remdesivir. It is the drug that is in the standard guideline of treatment of COVID in USA. This drug belongs to the group what we call antiviral drug. There are a lot of research over antiviral drugs and COVID, but the best evidence is one randomized controlled trial, cover 1,062 patients. But they did this trial for those patients who are already had pneumonia. All of them are in hospital, mostly under mechanical ventilation. The trial showed that remdesivir does shorten recovery time than the placebo, say 15 days for placebo. I mean recovery time, the time that they have symptoms. 15 days for placebo group, shortened to 10 days for remdesivir group. But remdesivir makes no difference in terms of mortality. Since pneumonitis occur mostly in hospital, so the likelihood of using remdesivir at home is very low. And I think I do not recommend using remdesivir at home because the research done in severe case in the hospital, and the benefit is only shorten symptomatic time a little bit, not make any difference on mortality, which we care. The most we care outcome is mortality. The third drug you mentioned, favipiravir, in Thailand is very popular in Thailand. They even put favipiravir in the home kit. It is also an antiviral drug. I think the best evidence about favipiravir is the meta-analysis done in late May, I think. It showed that favipiravir does relieve symptoms at day 7 better than the control group, but it makes no difference in terms of viral clearance, the need for oxygen and need for respiratory support, and the need for hospital admission, needs for ICU admission, and mortality, all are the same. I mean, between favipiravir and control group. So also, I do not recommend storing or taking favipiravir as part of the treatment of COVID. In the hospital, it may be useful to shorten or to reduce the symptom a little bit, but nothing else. It cannot reduce mortality. Hydrochloroquine, like you said, actually hydrochloroquine now is already proven that it is useless in treatment of COVID. And unfortunately, the research publication that support the use of hydrochloroquine was kind of turned out to be a fake research based on the fake data. And that research had been removed from the journal anyway. And the last drug you mentioned, a monoclonal antibody. The most famous one is tocilizumab. The trade name is Actemra. It is proven, this drug is proven to reduce mortality, but only in using combination with steroid, I mean dexamethasone, in hospital setting. They use in hospital setting. Most patients are under ventilation, mechanical ventilation. It does not cure virus, but it does reduce mortality. So it is very useful drug in late stage of COVID. Of course, that stage is hospital treatment, not home treatment. So I do not recommend to store tocilizumab at home. It is very expensive anyway, not worth storing. But if you had severe symptom in hospital, doctors will use it anyway. The last one is dexamethasone or other steroid. Also, there is one good study published in New England Journal that dexamethasone proven to reduce mortality in severe case. Who need respiratory support. Also similar to tocilizumab steroid, it acts on a reduced hyperactive immunity, not killing virus. So it is used in very late stage of disease when the immunity is very hyperactive. It is good drug, but to be used in hospital, not at home. So at home, I don't think we should store any medication for using at home at the moment.
Thank you, Dr. San. This clarifies some of our questions in my mind that I'm thinking of buying and keeping in my house. I have a nice refrigerator, but also thinking about the fact that if we don't store, and when we hear about the number of severe cases in any part of the world, when the world was going under, the developed world was going where elderly, they had 8% mortality. And severe cases were only in a certain range of 3-4%. More than 70-80% people are asymptomatic. The severe cases are very limited. So if you leave the drug out available, I'm sure it has a higher chance of reaching out to the people who need them, rather than having them and then not being able to use them at home. Spread it, as we say in vaccines. I hear them talking all the time that nobody is safe till everybody is safe. So I think it's important that we make sure drugs are available to the right people in the right place. Ladies and gentlemen, you're live, and if you have Q&A, you should put them in now, because our team will evaluate so that they can keep getting them as you keep writing. If you have thoughts in your mind, keep putting them on, so that when the time comes, we can answer them and try and answer a lot of your questions as much as we can. All right. So, Dr. San, now let's move on to something more simpler. I mean, I've had COVID. Now I'm free. I get an RT-PCR test. I come home. Now, how freely can I mingle with? I mean, sometimes there's this. I've had a friend who had COVID and his wife had, and they lived together, and he reached the fag end of his 21st day or after 14 days, but he still had some remnants left over, and he was in the office. He was meeting and mingling with us at times. So when am I free to go out and meet my loved ones or my friends and not wear a mask, or I still need to continue as good habit doing it for a long time? I mean, what's your suggestion? What's your guidance on this?
The question about when to discontinue isolation. There was a very good research done in Taiwan. We called it a contact tracing research. They follow the post-COVID patients, and that research proven that after day 6, from the onset of symptom, after day 6, the virus, if it's still there, it will not be viable or it will not be contagious anymore after day 6. So nowadays, it is agreement all over in medical community all over the world that after day 10, I mean 10 days after the onset of symptom, on condition that there is no fever during the last 24 hours, you are free to be discontinued from self-isolation. 10 days after the onset of symptom, no fever during the last 24 hours, then you are free. No more isolation need. There is exception to this rule, one exception for those patients, what we call immunosufficiency patient, immunocompromised patients, like HIV infection patients or cancer patient in the immune system, like leukemia, lymphoma, something like that. In those patients, immunodeficiency patient, the isolation time should be extended from 10 days to 20 days. But for overall 10 days after onset of symptom, no fever during the last 24 hours, you are free. But having said that, I mean, beyond that, still general, what we call universal precaution still need to be done. I mean, wearing mask, social distancing, clean hands often, still need to be carried on, but just the isolation that can be discontinued.
All right, so we need to still maintain good hygiene, good discipline as far as COVID behavior is concerned, masking, washing, keeping distance, if you want to get rid of COVID in our parts of the world. Something I think we have already talked about before, but I just wanted to ask this again. If I'm in touch with someone who has COVID, what should I do? Should I test? Should I isolate? Wait and watch? Because a lot of times we are thinking, yes, in our companies we have all these issues. I mean, in the lab we have a chemist who came in there, but we see them a little bit of time. We talk to them, but we are wearing masks. We have lunch with them. So at times, many times this you hear. I mean, I went to a bicycle shop, and the next day they told me that somebody had come at 10 o'clock while you were here, and he's tested positive with COVID. Now I'm sitting at home and saying, should I go and test? Should I? What should I do next? So any advice on what should I do? Should I just watch and look at my symptom like you advised before, the list of things to watch for? Should I just isolate? Should I go and do an ATK test and then wait and watch? What is your guidance on such things? Because in an environment where we live and work, we have teams, we have medical reps, we have offices, we still come into small numbers, and factories don't close. We have a factory running and we have people coming. We can't all of us stay and work at home, and it's a fact of life, you know. Livelihoods are also important. We can't just close down and close the factory. So your advice will be very helpful, Dr. Sand, on this matter.
Well, the rule of thumb is that once you are exposed to the infected person, you will need 14 days self-isolation, regardless of the test or not. That's the rule of thumb. Just exposed to infected person, you got to go for self-isolation for 14 days. Having test or not is optional. It's not important. Self-isolation after exposure is the most important to do.
Okay, so that's clear. Whatever happens, if we think that we've been exposed, doesn't matter 1 minute, 2 minute, 3 minute, 8 minute, doesn't have to be did I touch them, I was wearing a mask, but if we believe that we have been exposed, we should isolate.
Right.
Okay. Now, COVID, there's COVID, there is COVID, there is COVID A, there is Delta, there is Beta, there is all these things, but there's also something I hear now called long COVID. Now, COVID doesn't go away. You had COVID and the COVID stays with you and continues to show symptoms for a long, long time, even though your RT-PCR tests are fine, everything is clear, you have good antibodies, you've got a vaccination done. How do I know I have long COVID, and what are the symptoms? And then on top of it, what can I do about it? You know, how do I protect myself? How do I get back to normal life? How do I start living and becoming normal if I have long COVID? So your thoughts, your suggestions on long COVID and what can we do about it?
By definition, the definition of long COVID, it's defined as having persistent of symptoms beyond 4 weeks. Usually a short COVID, let's say, short COVID, everything should end before the end of 4 weeks. But after 4 weeks, if some symptoms still persist, that is called long COVID. In these people, some PCR still positive, some PCR already negative. So the symptom, it's better to review the symptom again, the symptom of COVID. Since COVID can involve every organ system, so the symptom is very, very varied. You know, I will run down the symptom again: short of breath, fatigue, and particularly for long COVID, post-exercise malaise, or simply poor exercise endurance. Brain fog. Brain fog. A cognitive impairment. You cannot think sharply, and you cannot remember. You cannot focus. That is brain fog. Cough, chest pain, headache, palpitation, or tachycardia. Pain in the joint, pain in the muscles. Paresthesia. Feeling numbness or tingling sensation all over the skin, wherever over the body. Abdominal pain, diarrhea, insomnia or other sleep disturbance, fever, lightheadedness, inability to do daily function, skin rash or urticaria, mood disorder like irritability, depression, anxiety, loss of smell and taste, and in women, menstrual cycle disturbance. All these are symptoms of COVID. If any of them persist beyond 4 weeks, that's what we call long COVID. Unfortunately, we don't know how to treat long COVID yet, because we do not know the cause of long COVID. So far, we can do at the moment is we do symptomatic treatment, and we do rehabilitation program based on good nutrition, regular exercise, and stress management. That's all. We do not have specific treatment for long COVID yet.
Oh my God. So that's a long list of problems which we could have anyway, even if we don't have COVID. So if I had diarrhea for a day, doesn't mean I have long COVID. But if it persists regularly over a certain period of time, it has to be persistent, has to stay on, has to be long, and doesn't go away easily. Symptoms that stay with us. And if we have had COVID, we can connect it with COVID. So it's still, I think there is still work going on. I hear there are studies in progress. I hear in the UK, there's work, a lot of studies, a lot of evaluation going on how to manage patients with long COVID. Some 6-7% of people with COVID have been found to have long COVID. That's my understanding from the research that I've seen. I don't know how accurate that is. Maybe Dr. Tan can confirm that about 6-7% seem to have some varying symptoms that carry on. Not all, but 6-7%. Well, so COVID has not only COVID, but it has some other parts that stay on with us and don't go away very easily. Well, Dr. San, I think one of the challenges of COVID, yeah, one is the medical side, the physical side. We also, I mean, life has been an year and 6 months. I mean, for me, sitting at home, I don't fly anywhere anymore. I've become a home bird and become a quite good man. Exercise, eat well, which I was, but a lot of exercise. But other than that, 24 hours, what do you do? Netflix, movies, read. People who can afford it probably watch. You don't go out very much. You don't meet friends anymore. There's no hugging, no meeting, no touching, no kissing. So it's all about home and home and home. And not only us, but then you have the younger people who are waiting to get into universities, don't interact with friends. And I'm sure there's an impact on your mind, on your mental state, and that is very concerning. I read that there is a lot of work going on how this is affecting children going to school, kids going to university, people working and their lifestyle, and how when they come back to work, how things will change. What is your view? I mean, this is from a more psychological and a more mental state of mind. It's not purely medical. I'm sure there's a medical connection to it. But any recommendations on what we can do to learn to live with it better and keep our mental state active, healthy, and alive while COVID still continues, because it doesn't seem to be going away very soon. So, any thoughts? Any thoughts from you on this?
Well, looking from another angle, COVID gives us more time to learn to be here and now. Instead of television, internet, why don't we try spending time in meditation, Tai Chi, yoga, also relaxation, or whatever that train ourselves, not to meddling with our own thought. It may be just sit quietly in quiet nature. Just try not to meddling with our own thought. COVID gives us two directions to go. One direction is loneliness. The other direction is solitude. Loneliness defined as being unhappy when being alone. Solitude defined as being happy when being alone. Actually, your name, Vivek, implies means solitude. So it's up to us to choose which direction we will go, loneliness or solitude. COVID gives us time, and we can choose the right direction to go.
Introspection, Dr. Sun says, it's a good time to look inside and maybe spend some time with ourselves, learn to enjoy the happiness we have. I know it's tough. I know we're very social human beings, and not doing something, inaction is like completely means you are not doing anything at all, but that's not true. Doing nothing is also doing something. So I think it's a learning for the world when we become not self-centered but self-oriented and make changes to our own mind and our own health. So thank you, Dr. Sun. Now let's move on to talk about further questions. We have done long COVID. We have talked about mental health. We have I mean, all of us are worried. All of us are worried. When will this lockdown go away? Is there ever going to be an end to this COVID? You know, I mean, last time he said 6 more months. I remember I went to Indonesia on the 10th. I said, never mind, 1 month, we'll be back again. See you soon. But it doesn't seem to be happening, right? It keeps adding 6 months, 6 months, 9 months. Now from 60% herd immunity to 70. Now I hear that herd immunity level's gone up to 80%. So, but at the same time, I mean, fortunately, I watch football, so thank God, I'm back to watching EPL, and everybody's sitting with no mask, and the stadiums are full, 60, 80,000 people watching football, while they are all happily watching football, and seems to be no lockdown, but they still have 30,000 cases a day, and I don't know, 900 hospitalization, 90 deaths. So, any thoughts on when do you think, or what's the right timing, or when do you think this will happen, when this opening up, especially in the developing world? I mean, I'm sure you cannot tell us about every country, when will Peru open up, or when will Ukraine open up, or when will Nigeria open up, but a general thought, when do you think we will reach, or the world will probably become more open to travel, more open to meet?
We are having two issues here. Number one is dealing with the outbreak of one disease. Number two is dealing with the variant virus, new variant virus keep coming. Let's discuss number one, dealing with the outbreak of one disease. There are only 3 ways to deal with this. The first way is what we call suppression or lockdown. Lockdown, unfortunately, not many countries can do this effectively. But some countries did it effectively, like China, Singapore, and New Zealand. It's a good example. For those who cannot do lockdown effectively, they step back to do the second strategy called mitigation. Mitigation means trying to delay the spreading of the disease so that the healthcare system of the country can cope with the number of the infected patients, and the vaccine will come and shorten the mitigation period. The third strategy for some countries where vaccine is not available is what we call unmitigation, or simply just let it blow in. Accepting large amount of caseload during short period of time with some mortalities, of course, and then very quiet and good immunity after that. For dealing with one disease is one of these 3 strategies, nothing more complicated than this. But dealing with newly variant virus keep coming again and again, that is the other story. And it is the world problem by now. In United Kingdom and in Israel, it's not a matter of invalidity of herd immunity concept. You know, the herd immunity concept is still valid, but it's a matter of all vaccine cannot cope with the newly emerging virus variants, and we will face this problem. I don't know how many variants to come, how many years in the future that we need to is needed to cope with it. So for the newly variant virus, no one knows what is the future.
All right, so there's more questions than answers. I mean, at the moment, what we know, the Delta variant is well looked after by some of the vaccines. So now we come to the big topic, vaccines. I think everybody is interested. What about vaccines? There is the Chinese vaccines, Sinovac, Sinopharm, approved by the WHO, and we cannot fight the WHO or the CDC or the NHS. They are not approved in the US. Then you have the AstraZeneca vaccine, which is the cheapest of the lot, easy to manage, easy to deliver, not major issues in storage. So then we have the mRNA, the mRNA vaccines, which are top, you can call the Mercedes or whatever you call them, the E classes of vaccines. So everybody wants them, because if I had this and I can say I've got mRNA vaccine. So it's a lot of vaccines around. Now we want to understand that which vaccines, are there any better than the other? Do I need to take one or the other? If I have the option, do I choose? But in many cases, I don't have options. Then I take what I get. Do I fly to the US and get mRNA vaccine if I can afford it? Because yeah, I can fly there. There's vaccine tourism around now, so I can also do that if I can afford it. So what vaccine should I be taking? I mean, there are a lot of questions on vaccine, but that's one area. Number two, there's also a lot of advice now. Even Thailand today announced, or they've been talking about it, that if you've had Sinovac, you should have the next shot of Astra. If you have had 2 Sinovac, your immunity drops within 3-4 months, so you should be having the next shot, whether it's Astra or even we hear the Pfizer donations have come, the mRNA should be given to medical workers first. Okay, anybody who's taken a Sinovac should get an mRNA vaccine. So that's the other part, second part. People who got Sinovac should get them. But then you have the next, we hear Angela Merkel, Germany has, among few countries have said, Astra plus Moderna give you the best protection. So combination vaccines are probably better. While the WHO still says stick to the same 2 doses and stay there. So there is all these things that are in our mind. We hear every day. And recently, that's about a few days ago, 1 or 2 days ago, CDC and the US government announced 8 months later you need a 3rd shot. So. And Israel has already started and announced giving 3rd shots to their residents of Israel, even though they had a very high vaccination rate with all Pfizer vaccines. So these are all these questions on vaccines that I probably will try and put it at one so that you can probably keep answering them one after the other. There are many more. I will probably take up as you answer these, and if some of them you have missed. But over to you, Dr. Sun, maybe you can give us a good overview on what you think about vaccines and vaccination.
So roughly we have 3 issues here. Which vaccine, and mixing the vaccine, and how many shots do we really require? Let's discuss which vaccine first. From vaccination point of view, the most important thing is vaccination coverage. Unfortunately, the full coverage is hard to achieve in many countries because they do not have enough vaccine to go around. From the medical perspective, which vaccine is not as important as vaccine coverage? Each vaccine design has its own good and bad points. All vaccines approved by WHO is effective enough in terms of preventing infection and reducing mortality for the original virus they are designed to cover. For the newly variant virus, that is another story. Usually, new virus and new variants require for new vaccine. That's a kind of a rule of thumb, You cannot tell which vaccine is better than another vaccine in this stage because new variant just begin to parade out. We don't know how many to come. We need more time to assess efficacy of each old vaccine against each new variant. At this stage, when the vaccine coverage is still far from achievement, I think whichever vaccine is okay. Just try to get fully coverage injection. Now the mixing vaccine, actually mixing vaccine is never an idea in medical community before, because mixing vaccine, it means we discard the result of very good comprehensive clinical trial we have done for that vaccine to believe in small and not well structured information during the usage of the vaccine. So mixing vaccine is not standard practice. We need time for research, which should be mixed with which. Anyway, from the mechanism of action point of view, let me use something like 1 minute to clear here a little bit. Our immunity system concerning using vaccine, it is divided into two subsystems. The first one we call cell-mediated immune response, or CMIR, which once we get to know the disease, then we build the white blood cell like CD4, CD8 to cure the disease. Another subsystem is humoral immune response, or HMIR, which means the body produce a molecule called antibody to cure the disease. Some vaccine is good at stimulation CMIR system. Some vaccine is good at stimulation HIR system. So mixing them up may end up with much better immunity. But we need time to evaluate that. At this stage, we cannot say which should be mixed with which vaccine. About the third shot, the number of shots required for each vaccine, it depends on the research done for that vaccine. Naturally, some vaccine need only 1 shot. Usually they need 2 shots. Some vaccine like hepatitis B need 3 shots. Some need 4. So we don't know yet at the moment, because COVID vaccine was brought out quite urgently on the assumption that 2 shots should be enough. But we don't know. We need more time to assess number of shots required. But the important thing is that in this world, we will see that in underdeveloped country, they do not have enough vaccine to go around for the first shot. So they keep on producing new variants, because in the outbreak, mass infection, we produce a lot of new variants. But in the developed countries, they already accomplished their second shots. So they are thinking about producing new vaccine to COVID new variants. So it's kind of a game that never ends, The poor country produce new variants, the rich country produce new vaccine. Like this, And I don't know where it will end. I don't know.
Oh my God. So you're not going to stop here. You mean because of lack of vaccine, because the herd immunity has not been reached, the mutation happens and you will see new variants coming in. So like I said, till everybody is safe, nobody is safe. So I think we need to vaccinate. We need to get more people who have COVID or building immunity, so we see less variants and hopefully see improvements in our health condition. Well, Dr. Sir, there is another issue. I mean, many of us are concerned. I mean, I take a vaccine, but every time you hear he is vaccinated, he got Pfizer, but he got COVID. He got Astra, he got COVID. Okay, you may have a Chinese vaccine, people got Chinese vaccine and they got COVID. So having a vaccine of whether it's mRNA or vector or any one of those, you still have a chance of getting COVID. And after getting COVID for a while, originally, I remember reading some research when actually Israel did the original studies that by taking mRNA, you also reduce transmission rates. But with the Delta variant, the transmission rates have not gone down because it's up in the US, it's up in the UK, it's also growing in Israel. and China that had completely locked down every corner of it is also sneaked in through somewhere or the other. I don't know how it's got in, but it's there now in all these places. So does taking vaccine, does it stop us from getting COVID? Does it stop transmissions? And if it doesn't do both of them, then why should I be taking vaccines? It's as good as not taking it. What's your advice on that?
Based on the information so far, getting vaccine surely does reduce infection rate and reduce overall mortality. But it is not 100% or not close to 100% because the coming of new variant viruses. So in addition to depending on vaccine, we need something like personal measure to prevent ourselves from getting infection, particularly from those variant virus which not covered by the current vaccine. What need to be done is that firstly, we got to stick to what we call universal precaution as a personal prevention measure. Always wear mask, social distancing, clean hands often, and get vaccine if possible. Secondly, we got to change our own diet to a more plant-based diet, more fruits and vegetables, less animal products. And thirdly, we got to maintain regular exercise so that our immune system can maintain its function. Fourthly, we got to get adequate sleep because the immune system needs that. And fifthly, we need to expose ourselves to nature a bit, particularly the sunlight. Sunlight provides us vitamin D, which is vital for immune function. And if that is not possible, we cannot get exposed to sunlight, I would recommend supplement with the vitamin D. And sixthly, we got to manage our own stress. Learn to live here and now without negative thought, without meddling with our own thought. And seventhly, only for those whose nutrition is not adequate, cannot properly eat, I would recommend supplement of vitamin and minerals, particularly vitamin A, vitamin C, vitamin D, vitamin E, and zinc. But for patients whose nutrition status is normal, there is no evidence to show that any supplement can help reduce COVID mortality. Just for those whose nutrition status is abnormal, that supplement will help. So I think all these 7 things we need to do to protect ourselves from dying. We are waiting for the best vaccine that cover all variants to come, which no one knows when we get that kind of vaccine.
Okay, thank you. That gives us a very clear picture. I think we had talked about opening up of countries just now, so maybe the next question we can move on. Because we did speak about, you just mentioned about how and when you think the countries can open up. You did explain to us on how this herd immunity will be achieved. But I think the question that comes to mind is, Dr. San, now that, what do you think is the way forward? I hear you talking about good health, talking about good sleep, building immunity, but this is not just about today. There can be another pandemic, there can be another virus, there can be another variant. But on a long-term basis, if you look at the world, look at country, look at yourself, and when we say this is all about good health by yourself, you are equally responsible for your own health. We can depend on the doctor, we can depend on the medical society, pharmaceutical companies, and the government to provide us all the beds and the medicines. But what about us? What can we do ourselves to look after our health so that this kind of pandemics that will keep coming, and there is no end to that variants flying around. Can we do something? I'm sure there are 15-20% genetic cases. There are a lot of things that we can't solve all the problem, but can we make ourselves more foolproof against all these diseases that will keep coming and it's not going to come to an end? Can we do something about it? Do you have any suggestions on how we can make those changes in our life to stay healthy, to remain healthy, to get healthier and probably be able to fight these infections and new viruses that will keep coming, and there's no end to it, because other than taking vaccines every year when they develop them, right?
I think COVID time is probably the best time to start thinking about this. I mean, to start taking health into our own hands. Usually health is taken care by the government, by health authority, by doctors. But COVID have shown us that is not work. So it is the high time to take health into our own hands, because the only one measure that can prevent us from COVID or from any disease is our body. With properly fed, properly taken care of, this body is very good design. It can heal itself from any disease. No one can take care of our body as good as ourselves. So I think COVID time is the high time that we should bring health into our own hand and start taking care of ourselves. Do not rely on the public health establishment or doctors. Just rely on you on your own to take care of your own health. I think that's the key point from now on.
Well, thank you so much, Dr. Sun. It's been fantastic to hear you and get an honest opinion. As I told you, we see these episodes are all about truth on wellness, truth about wellness. We are also searching, looking around and trying to help people stay healthy as long as they live. But in this, the number one responsibility lies with you. We are not magicians. We make medicines. Yes, you are sick, you need them, you need to operate, you need to operate, you need to go and see the doctor. Yes, very important. But at the same time, I think a lot of the power lies in our own hands to make that change, to make that difference. The only answer doesn't lie in the pill. The answer also lies in us making lifestyle changes. And there are ways to do that, to get your weight right, eat right, exercise right, sleep well. And I think we can all make an effort in the right direction. And that will probably reduce the worries we have and probably reduce the possibility. It doesn't say eliminate. There's nothing 100% proof in life, but it at least improves your chances of going through these different difficult endemics, pandemics, and all kinds of non-communicable diseases. So that's the message from Dr. Sun. That's the message from Good Health by Yourself. That's the message from Wellness We Care, an initiative of Mega We Care. We care for your wellness. That's why we are here. That's our only life objective. That's the purpose why we are here. So before I close, we have a few questions that are come out that have not been covered. Some of them, I think one of the questions that I see here, which seems to be a lot to do with children. For children less than 12 years, they have to handle them differently. We are hearing that there are more cases appearing in children, and there are guidance now here. I mean, vaccines are being approved below 12, under 18 already. I am told UK is approved, US is approved. What about children under 12, kids especially, in terms of vaccination? And some people say this is a good idea to give them influenza vaccine as a stopgap measure. I mean, I don't know that, but I don't know if I have the answer. But let Dr. Sun probably answer what do you think about children and the vaccination for children and how do we manage them? And is influenza vaccine an option other than vaccines for COVID? Dr. Sun, over to you.
Firstly, vaccination for children under 18. The usefulness of doing this is to prevent them to carry the disease to elderly people. But to protect the children themselves, I think it is not necessary because the mortality rate of this age group is very low, except for only few subset group of children, obese children, children with asthma and chronic allergic disease, and small children under 1 year. In these three subsets, probably if possible, probably they need vaccination to reduce mortality. And the rest of children, they don't need vaccine to reduce their own mortality, but vaccination will prevent them from carrying the disease to elderly people. Another point worth mentioning is the newborn babies. The newborn babies, their immune system is not well developed, so they can contract COVID from adults easily. So it is very important that we have to isolate infected adults from the newborn babies always. For instance, if a breastfeeding mother contract COVID, she should be isolated from her babies because the babies can contract COVID easily. Concerning the influenza vaccination to prevent COVID, at the moment we do not, unfortunately, we do not have evidence to show that. But from the conceptual thinking, we believe that influenza vaccination will increase immunity toward SARS-CoV-2 virus, which is the cause of the COVID as well. Just the belief, no evidence.
So there's no evidence, and I think without evidence you cannot go and take it unless you want to be the scapegoat, the first person to try it out. It's a decision that you have to make. We have another question which is common probably in many cases. A lot of us live in air-conditioned houses, air-conditioned offices, and you mentioned a while ago that we should be ventilating. If we live in houses, we should have more open spaces. So in that case, that means we should be wearing a mask in the office and whenever we are in air-conditioned places, number one. Number two, do you believe that this virus is an airborne virus? I mean, is it an airborne virus? So that's why we need to do that. And is it a good idea to do hot steaming, gargling, salt water? Will it reduce the possibility of the COVID virus get infection, or if you're already infected, it doesn't do anything at all? So, all related with airborne and masking in air-conditioned areas, what's your view on this, Dr. San?
About the air conditioning, and there is a very good study done by Harvard. They put the COVID virus on the aerosol, I mean a small particle of the small particle floating in the air, and let that particle with COVID virus float around in the air-conditioned room. Door closed, window closed. We divide such room as poorly ventilated room, Basically, it's air-conditioned room. It appears that the particle can travel all over the room, and it can stay on the air for at least 3 hours. And another study done in China, in the restaurant with air-conditioned room, people can get COVID. That's why they sit far away from each other, but in the same air-conditioned room. So the evidence at the moment does not support staying in air-conditioned room with people who may be infected with COVID virus. Better to open doors and windows. And the virus, I mean the COVID virus is airborne. It's not the belief, it's the fact actually that the COVID virus travel through the aerosol and to the droplets in the air. So it's airborne virus, of course.
And we have steaming and gargling to help.
One thing worth mentioning is that the study done with the SARS-CoV-1 virus, SARS-CoV-1 virus is kind of a brother sister of SARS-CoV-2 virus. these virus, they're very sensitive to heat. At the 38 degrees centigrade, they all die. So the one thing is that if you get fever this time, you should not take antipyretic. You should get a blanket so that your temperature is keeping high. And naturally, your body will chill and sweating. And after that, you can go to take a bath. That is probably the best way to use body heat to kill virus. For the hot steam, I don't know. There is no research done about this thing. I don't know. It may help, it may not help, I don't know. But to keep your body temperature high during the fever, it is very sensible to do.
All right, so we have a few more questions that haven't been answered. One question that has come up is when do you know it is time to run to the hospital? And home isolating, I had my symptom when I started. When is that point when I should be worrying and saying, let me find a room when let me get to the hospital, because now it's getting just beyond that point? Is there a certain indication there?
It's the only one symptom that indicating that you are getting what we call the doorway to cemetery, doorway to bad outcome, is the dyspnea. Dyspnea, I mean the inadequate breathing. You feel that it is what I call this medical term, they call dyspnea, difficult to breathe, not enough air. Whenever you have this symptom, it is the indication that pretty soon, you will die. So at this point, you got to seek hospital treatment, no other way else. So the difficulty in breathing is very significant symptom.
All right, so that means you have to be ready, and as soon as you start feeling that you can't breathe very well and it's getting more and more difficult, it's about time to find and start searching for hospital beds and get under treatment. I mean, there are some common questions, but nothing very serious. I think there's one more I would like to ask Dr. Sun. What was that? Well, there's something called vaccine hesitancy. In some places we call it an anti-vaxxer, and in places we call it a vaccine hesitancy. When we started here, a lot of people didn't want Sinovac, then they didn't want this, then they want only mRNA, and they're all waiting for it. And then suddenly, when COVID went off the roof, everybody is now queuing up to get whatever they can get. So, I don't want to take a vaccine, and we try very hard to convince them, oh, it's not about you. And I read about this, read from this lady who was very famous in this serial called Friends, and she said that it's not about me. I mean, I should take a vaccine because if I don't take it and I give it to somebody else, it's even worse, because I may be fine, I can find myself protected, but what about others? So you do it for others, not only for yourself. So she had a very good logic, and I think it was fantastic. But it's very hard to convince people. So they're asking you, what can you do about it? You can do nothing. You can only convince them. And there are rules now. I mean, there are a lot of companies have said now that if you're not vaccinated, sorry, you can't come to work. If you're not vaccinated, you can't do this. And there are rules that are being made by you like it or not. Many companies are putting this in kind of writing that if you want to come to work, you have to be vaccinated. Unfortunately, we don't have the luxury to affect another 100 people in the company and stop working. So, if you right or wrong, is it against your rights, human rights, rights? I have no right, I won't be vaccinated, but what are the choices? So, Rogosan, any thoughts on that?
I think vaccine hesitancy. The cause is one is that what we call mass media, who's based there, based on the what we call conspiracy theory. Conspiracy theory, which in medical terms kind of a nonsense thing. From medical point of view, or from scientific evidence point of view, vaccination coverage is the only way to subdue the outbreak of the disease. And we learned that from very serious diseases before, like poliomyelitis, smallpox, even measles in small child. We can subdue the disease by achieving vaccination coverage. So vaccination coverage is kind of a joint venture between people in society. Everybody needs to help to reach the full vaccination coverage, which is 70 or 80% coverage. Otherwise, the whole society will not be protected from the disease. So I think it is sensible to make rule or to make law to compel people to get vaccination. So discard the what we call nonsense conspiracy theory. I don't recognize those conspiracy theory because I base my advice and decision on scientific data only.
I think there is also, Dr. Sam, there's a lot of discussion on vaccinated, unvaccinated people. Now, unvaccinated people, unvaccinated people. I've seen some studies recently. I mean, yesterday only I was reading the UK results just came out and they said the number of deaths that happen in UK, majority, 55% of the were people who are unvaccinated, even though they were over 55. Yes, the vaccinated also died, but majority of them happened to unvaccinated.
Yeah, that's true.
And the second highest number happened to those who had one shot. The third happened to those who had both shots. So the question people are asking is between vaccinated and unvaccinated people. I mean, I don't know about contacting. What's the chance of contacting COVID? If that's the measure, what's the chance of transmitting COVID? And this we have seen transmission and contacting is not very different because we still get it. But the real effect of vaccination is hospitalization and death and severity. And that seems to be the main benefit of having been vaccinated. And is there evidence enough to show that there is a big difference between the vaccinated and unvaccinated when it comes to hospitalization and comes to mortality?
Yes, that is true. Looking from the individual point of view, if one cares only oneself, the vaccine proven to reduce infection and reduce mortality for oneself. But for the whole society, taking vaccine kind of a joint venture, I would emphasize a joint venture to help the whole society to achieve vaccine coverage.
All right, so that comes to my last question. And there is a question that is there any preferred vaccine for pregnant breastfeeding mothers? Is there any stage of pregnancy when it's the right time to do that? Do you have any suggestions on that, or if it's approved by the government, they're equally as good? Any suggestions?
At the moment, we do not have vaccine that has been tested in pregnant or breastfeeding women. So there is no answer for this yet. And it is very important not ignore the fact that pregnant women are another isolated and different group from other people, because we learned the hard way from the duck call. You may remember thalidomide, which creates something like 35,000 malformed newborn babies, because we ignore the fact that pregnant women are different people. So I think we have to wait for the study for new version of vaccine that being properly tested in pregnant women. I don't think providing vaccine that is not tested in pregnant women to them is not a good idea.
Well, ladies and gentlemen, friends from 33 countries and your families and all our friends who I know and we know, thank you for joining us today. It's my first episode. If we didn't do it, I'm sorry. There are things we didn't answer. We again apologize. We had a lot of questions which were common. We tried to answer as many of them as we can. This will be available on YouTube. You can go back and see the videos again. There will be the transcript available as well. and you can answer some questions online later on as we go along. If you have any ideas on future episodes you would like to look at, please suggest. We will also consider doing them. So till then, I wish you all safe life. Hope you are able to live through this COVID that is not going away very soon. It's going to take a while, and we have learned to live with it for 18 months. I think we'll have to do so for some more time. So wishing you all faith, good health. Please make a difference. Please make a change. Please go out and do something about it yourself. Change your diet, change your lifestyle, get into exercising, sleep well, and stay healthy. That's the only way this world can become a healthier place. It's all in your own hands. Be helped by yourself. So thank you, Swati from Thailand. Thank you, Achan from the Sun. Sayo Singh will be very kind to give us all his knowledge, expert time and effort. So thank you, gentlemen. Thank you, friends. Thank you, everybody. Good night. Good day. Have a good evening. Thank you.